If you've been to the channel before, welcome back. If you're new to the channel, then welcome. Today is going to be a really important video where we discuss filler, especially in the face, and how everything that it's described to be isn't necessarily the case. Not only are there some misleading suggestions about facial filler, but some of what we have been told is a downright lie and can lead to extremely serious side effects and very detrimental results. Please stay with the video until the end because there are some real surprises in the list of filler lies and myths. So filler is a huge market across the world, representing in 2022 a $5.5 billion industry. It's suggested that by 2029 it may be up to as much as $9 or $10 billion worldwide, and it, with Botox, represents 80% of all cosmetic surgery interventions. Having said that, there are a vast number of myths and mistakes associated with filler practice, and the general public aren't necessarily completely aware of what it is they're letting themselves in for. The filler companies and practitioners tend to downplay any of the side effects, some of which are well known, but some of which are very important but more subtle, and it's these that we're going to discuss today. Filler is essentially made up of a compound that we have throughout our body called hyaluronic acid. Hyaluronic acid essentially is the mortar between the bricks or cells. Now, hyaluronic acid that we inject is made of exactly the same stuff, but to make it more useful in clinical practice, it is cross-linked. What cross-linked means is there are chemical bonds between individual molecules which tend to make the hyaluronic acid thicker. As a result, we can have thin hyaluronic acid, almost as thin as hand gel, which is great for applications in delicate tissues or where the skin is very thin. We can have very cross-linked hyaluronic acid, which is very thick, almost as thick as bathroom sealant or a Jelly Baby. And this filler is only suitable for use in deep areas below lots of soft tissue cover. We will touch a little on this later, but using the wrong filler in the wrong area is a common mistake and can lead to problems. So in this video, we're going to discuss many of the myths and in some cases downright lies associated with filler practice. And I'd very much like to start off with one of the key myths, which is filler creates a youthful appearance automatically. Now, this is very far from the truth. What filler is very good at doing is replacing lost volume. And in anatomical areas where lost volume creates a look of aging, then filler can be very useful. Good examples of where lost volume creates sag, which we associate with aging, are the breasts, the lips, and the cheeks. If your goal is to replace lost volume, then yes, consider some kind of volumizing agent. And filler is one of these. There are also semi-permanent and permanent fillers, fat and implants, all of which can do the same job. What I often see is people having filler in areas which haven't lost volume in order to try and create a more youthful appearance. And all this tends to do is bulk up areas that didn't need bulking and create heaviness and stiffness in the tissues, which is at best not rejuvenating and at worst looks clumsy, indelicate, and not at all attractive. The second and probably the most important myth associated with filler is that it is temporary. Now, this is something we really should discuss in detail because it is one of the main selling points of filler. Why don't you try it? If you don't like it, within 6 months or 9 months or 12 months, the result will have gone away and you'll be back to where you started. Now, the reason why this isn't the case is because filler itself, made up of hyaluronic acid, is broken down by the body. And in a controlled lab environment where the filler is injected into a biological model and the amount of time it takes to break down is measured, then yes, 6 months or 9 months or 12 months for the different types of cross-linked filler will be representative of how long it lasts. The difficulty is in humans, this is not how filler is injected. What we find is, in the first instance, filler is injected in globules, and these globules tend to range in size from small to medium to large. from a simple biological surface to volume ratio. The small globules are broken down by the body sooner. So what we tend to see is 1 day after your filler is injected, the filler is starting to be broken down by your body. By 3 months after the filler has been injected, then these small globules will have been broken down and the medium-sized and large globules will persist. What this tends to look like is a lumpy area appearing where the filler was previously smooth. Now, you would argue that you paid for 6-month or 9-month or 12-month filler, and after 3 months you're already seeing a loss of smoothness and a loss of evenness of the result. But unfortunately, this is simply a product of the biomechanics of the filler being broken down. It's therefore very difficult to tell you how long your filler will last. It is also dependent on whether you do vigorous exercise, whether you massage the area, your biological makeup, and also how delicate and accurate your filler practitioner was. Areas of vascularized soft tissue tend to dissolve filler faster than areas close to bone. So for example, lips tend to dissolve filler quickly, whereas the tip of the chin tends to dissolve it less quickly. The next and probably the most important misconception around filler application is that once it's gone, the result will completely resolve. This is very far from the truth and is something that I see very often in my clinical practice. What happens is each time filler is injected, either with a needle or a blunt cannula, injury and trauma is introduced into the area. Now, these tissues are often very delicate, like the eyelids or the lips, and repeated injury and trauma causes lines of scar tissue inside these delicate parts of the body. Furthermore, the filler can cause granulomas. Granulomas are the body's almost allergic but very slow allergic reaction to foreign bodies, and rather than the filler being broken down, these granulomas can persist, leaving small nodules that can be seen on a microscope, which create their own volume. These granulomas can last many years or in some cases can be permanent. The third concern is that when filler is injected in a less than sterile environment, and even when it is injected in a sterile environment, you can introduce small low-grade infections with the filler. Because the filler is a foreign body, the infections can latch onto these foreign bodies and persist, again causing deep areas of scar tissue and granuloma, which persist long after the filler in other parts of that particular tissue are broken down. What this means clinically is that months after your filler has long been gone, according to the directions on the box, you will find that there is some lumping, some volumizing, some stiffness of the tissues, which persists. Now, when this is a delicate area like the lips will remain lumpy and uneven. The lumps and bumps can be very difficult to treat if they're made of scar tissue or granuloma and not filler. And unfortunately, in many cases, rather than being temporary, as was originally suggested, this unevenness and volumization can be permanent. In severe cases, this can be quite disfiguring, leaving only lumps, granulomas and scar tissue, and this is certainly not something that people would expect when they have their filler applied at their local esthetician. My advice to everybody is that if you've had filler in the same part of your body 3 or 4 times, then you should very much stop and think, am I going to want this area volumized for the rest of my life? Because if not, I'm going to leave layer of scar tissue upon scar tissue, granuloma upon granuloma, and long after the filler has gone, I may still be left with the volumizing effect. Once this volumizing effect is in place, the only real way to treat it, other than using fairly toxic chemicals to try and dissolve the scar, is to surgically cut it out. This can be very damaging and disfiguring and is something that most people wouldn't imagine they would have to discuss after they're out of filler to their lips. The next thing I would very much like to discuss is certain parts of the face where filler is used in an attempt at rejuvenation. As we mentioned before, loss of volume can be replaced with filler, and this has a rejuvenating effect. I find that filler is very useful in the early stages of loss of cheek volume. What we find is that the maxilla or the cheekbones become a little shorter and a little anteriorly sloping as we get into our 30s and 40s. What this means is our soft tissues of our cheeks, which are mostly made up of fat, tend to slide off the front of our cheekbones and slide down our face. This creates a lonely eyelid, a gap between the eyelid and the cheek, which we call the tear trough, and it also creates subsequent heaviness around the corners of the mouth, which we call nasolabial lines. It's important to accept that this aging is to do with falling of the midface, not specifically loss of midfacial volume, but loss of volume certainly has a role in some people. In the early phases, when the cheek is just starting to fall, filler can be a useful treatment to fill in the gap between the lonely eyelid and the falling cheek. Care must be taken, however. This is a very delicate area, and in the medium to late stages of this process, what we find is the eyelid and cheek become so far apart, all that lies between them is a very thin layer of eyelid skin, which has no soft tissue underneath it, only the bone of the cheek. If you put filler in this area, it tends to look lumpy and uneven, which is not attractive. It can also be visible through the skin, especially if thicker filler is used. There is furthermore an effect called the Tyndall effect, whereby the filler reflects light in a blue wavelength, meaning that it looks somewhat like a blue slug has crawled into this gap between the eyelid and the cheek. This is not desirable. And so, in my experience, filler in the cheek-lid junction should only be reserved for patients with very early lid-cheek disjunction, or specifically for loss of volume in patients who either have fat-losing medical conditions or who are extremely athletic in the face and are at that age where the face is just starting to fall. The next filler myth is that filler in the nasolabial lines can help push up the cheek. This is a follow-on from our last point, but it's very much not the case. As we described, the midface falls, creating nasolabial lines. These nasolabial lines cast a shadow down towards the mouth. Now, this shadow is noticeable and is a sign of aging, but people consider that if you inject filler into these nasolabial lines, not only will it prevent the shadow from being cast, but the theory is that the cheek will be pushed back up the face, back to being friends with the eyelid again. In my experience, this is never the case. All that happens is you create some heaviness around the sides of the mouth in the lower third of the face, which is usually masculinizing and not very attractive. Also, the scar tissue that forms creates stiffness and a lack of subtle animation when we smile, when we talk, and this again is not attractive. This is not beautifying, and it is certainly not rejuvenating. For me, filler in the nasolabial lines is very, very rarely a good option. The next place where I don't think filler is of great effect is the corners of the mouth. For the same reason as we've described in the last 2 points, the corners of the mouth turn down as we get older. Again, this is the cheek sliding off the face and down towards the jawline. It has been suggested that a little bit of filler in the corner of the mouth can turn this corner back up. But again, what you're asking the filler to do is to push the entire face back up the hill, which it is never going to do. What it tends to do is create some stiffness and woodiness around the corner of the mouth, especially after multiple applications, which again, in my experience, is not rejuvenating. The last place that I want to talk about in this section, and I think it's almost criminal to consider putting filler here, is along the jawline. For exactly the same reasons that we've described, the face slides down the cheek, and eventually not only does it bring the corners of the mouth down, but it slides across the jawline, creating jowls. It has been suggested that if you fill in front of the jowl in an anatomical area called the prejowl sulcus, then this will create a defined jawline again. Believe me, this is not the case. All you do if you fill the prejowl sulcus is you create a square, manly jaw with heaviness at the very bottom third of the face. This is almost certainly likely to be aging, and it is not in any way a reversal for the aging process, which starts at the mid-face and gravity pulls everything down. As you can imagine, additional volume at the jawline to make up for a cheek that's sliding across it is never going to be a rejuvenating procedure, and in my experience makes the features look indelicate and clumsy. An area where I've often heard people have filler and quite large volumes is in the temples. It is true to say that the temples become a little hollow as we get older, but it's very rarely that I've seen a patient and thought, oh, the one thing that you need is more volume in your temples in order to refresh your face. In the vast majority of people, age is reflected in the eyes, the eyelids, the cheek, the corners of the mouth, the jawline and the neck, and almost never have I seen hollow temples be a significant part of that process. What we tend to find is hollow temples is a place where 2 to 3 cc's or cubic centimeters of filler can reside. And so by filling both sides, it's a great way to sell 6 cubic centimeters of filler, which is a real win for the filler practitioner, but in my experience, not much effect or advantage for the patient themselves. If it was up to me, I would never put filler in temples. Something else I'd like to talk about is the thickness of filler and therefore how long it lasts. As we mentioned at the start of the video, thicker filler is more cross-linked via a chemical process, which makes it longer lasting because the body finds it harder to chew up thick consistency filler than it does chew up thin filler. This is a useful thing to know if you're filling a deep area with lots of soft tissue cover. I jokingly say that if you put a teddy bear under a bed sheet, you can still see the arms and legs, whereas if you put a teddy bear under a duvet, you only see the volumizing effect. This is the same with filler. If you put medium or long-lasting filler in a very thin tissue area like the lower eyelid or in the lips, you will see the lumps and bumps. If you put thin filler in deep tissue areas, yes, you will get the volumizing effect, but it won't last very long. So it's very important to put the right volume filler in the right part of the face, depending on the application. Yes, of course, we would all like our filler to last as long as possible, but the payoff is always the filler becomes more visible in superficial thin tissues, and so thinner is better. One of the key advantages of filler is that it is meant to be temporary, and certainly if you have it only once or twice, then thin filler in one of these areas is an opportunity to try to see if you like the effect. You may then consider discussing with your filler practitioner whether you want to use a thicker filler next time and if that is appropriate for that particular application. The next area of the face which I think is poorly understood when it comes to filler is the tear trough lower eyelid junction. As we mentioned, as the cheek falls away, the eyelids become lonely and the tear trough appears. In an attempt to create vertical height to the cheek, but also to create rejoining of the eyelid cheek subunit, filler is sometimes used. Now, the difficulty is, as we mentioned, this tissue can be very thin. The other thing, which is specifically a problem in my case, is that many patients, by the time they hit 40-something, have eye bags. Now, eye bags are herniation of fat around the eyeball, which lean forward against a structure called the orbital septum. Filler sits below these eye bags, and in fact, it's very dangerous to inject filler behind the orbital septum. But filler will not push back or improve or remedy eye bags. All it can do is fill the gap beneath the eye bags and above the cheek. So be very careful if you have eye bags and somebody suggests that tear trough filler is the answer for that, because it is almost certainly definitely not the answer for that. And somebody who thinks that might be the case may be tempted to inject the filler into the eye bags themselves, which is very much a bad idea. Another pretty well-established myth amongst filler users is that the reason why filler is so effective is because it creates collagen. Now, you will see this in all of the product literature, and you will see it across the internet and actually in some scientific journals. Now, for some background information, collagen is simply scar tissue. Collagen is what the body produces in response to some kind of trauma, or either sharp, blunt, or the trauma of stretching, damaging, or aging. Now, collagen creates a lattice or network of fibers through the injured tissue. These fibers actually tighten the tissue a little bit in the early phases of collagen formation, but they also create some stiffness and some thickness. Now, all of these things happen when we use filler, but not because of the filler. In my experience, the reason why collagen is formed is either because of the multiple traumatic passes of the needle, the subclinical infections, the granulomas, the foreign body reaction of the skin to material that it tries to absorb, and the collagen itself is not specifically formed by filler. Collagen can be a good thing if you're in the first or second time that you've had filler in a given area, but as we mentioned, if you're having filler 4 or 5 or 6 times, what you find is the scar tissue, collagen and granulomas become the predominant effect in that area, creating stiffness, woodiness, and a lack of subtlety when we move. This is a look that we've all seen in many celebrities and TV personalities during the ages. and we know very much who it is that's had too much filler because their face just doesn't move in a natural way. So yes, injecting filler causes collagen. I don't think filler itself causes collagen, and don't assume that collagen is a good thing, because too much collagen is too much scar tissue, and this can be a very serious problem. As a follow-on from this, filler only lasts 3, 6, 9 or 12 months in a fixed biological model in the lab. Well, this is true, but we all in plastic surgery practice have anecdotes where we have seen filler come out of people's faces and the patients have sworn to us that it's 3, 4, 5 years since they've had any injected. I had one specific case where a patient had filler injected 12 years ago, and it had become compartmentalized around the buccal fat compartment, and it remained exactly as it was injected many years later. So something else to bear in mind is, in some applications, which admittedly are rare, and certainly in some patients and in some parts of the body, filler is not temporary and can be semi-permanent or permanent. If you think that the effect that you're asking for is only going to be for 6 months or a year, think carefully about that, because there is no guarantee this will be the case. Other things which aren't such a downer on filler are applications where I believe it's useful. As we mentioned, I think cheeks, where patients have particularly slim faces, can be a useful site for filler injections. The tip of the chin for subtle chin augmentation is a good place for filler. I think subtle nose reshaping, like supratip indents or previous traumatic injury, can be slightly improved with filler, although again, all of these by definition should be temporary. Don't ask filler to completely change the shape of your nose, create better tip definition, change the shape of your alars, because it won't. But if you have subtle contour defects in the nose and you accept that it's only a subtle change that can be achieved with filler alone, then yes, these are good indications for filler in the hands of an experienced practitioner. Something else which I think is probably worth discussing is that filler has been used in certain preparations to boost skin. One specific brand is called Profhilo, and personally I don't quite understand how it could work, but I must accede that I have a number of patients who've come to me saying that they've had a course of Profhilo treatment and it was effective in smoothing out their fine lines and wrinkles. My personal view is that multiple injections into the skin cause local areas of stiffness, scar and trauma, which in turn causes some swelling. As you can imagine, if your skin and face swell even a tiny little bit, it will iron out some of your fine line wrinkles. But I can't deny that I've had a number of patients who believe that skin boosting filler was effective for them, and so I can't suggest that skin boosting filler is anything other than beneficial in my experience. Other factors to bear in mind when considering filler, which are well documented, are injecting filler into an artery, which can cause occlusion of the artery or the tissues that artery supplies blood to. This can cause death of tissues, which is very serious when it's the tip of the nose, the lips, the eyelids, or other delicate areas of the face. Make sure that you know that your practitioner is trained in how to manage complications such as this, and in my practice, in almost every circumstance, filler is injected using a blunt cannula, which is like a metal straw with a hole in the side. It's very hard for this cannula to puncture an artery, and so the filler is much less likely into an artery where it can damage tissues. I strongly suggest that you ask your filler practitioner to do the same. Overall, filler is and will continue to be an extremely popular way of changing people's face shape and rejuvenation. The key consideration for me is that don't assume that all filler is good. Don't in any way think that if some filler is good, more filler is better. As I mentioned, filler is only really effective for replacing lost volume, and this represents only a very small number of applications in the face. If you have had facial filler and you've had problems, or if you have any concerns about cosmetic surgery and you live in the UK, then by all means get in touch with me here at Adam Goodwin Surgery. If you have any other comments about this video that you would like to contribute, then please fill them in the comments below. If you would like to see a video about myths and lies associated with Botox practice, then please visit my channel, where you will see a video describing lies associated with Botox application that people really should know about. And if you have any ideas as to what videos you might like to see, then please get in touch with me here at adamgoodwinsurgery.com.